Guess we're going to get some cool weather finally here.
Yeah, it's about that time. Last year I didn't even take a coat out.
That's unfortunately year by year it'll get more like that.
Global warming.
Yeah.
Hey Dennis, so considering that we have the PowerPoints, do you want me to start sharing my screen from the get or give you some time to, let people in?
You could go ahead.
Okay,
Yeah.
thanks.
I think we're ready to get started. So we'll go ahead and hit record and get us started. Good evening, everyone. I'm Dennis Stone, Executive Director of the Center for Advocacy and Social Justice at the Jacksonville Urban League. And this evening we have a special guest discussing maternal health, particularly Black maternal health, and really what is the crisis in statistics and impact on mothers and children and their families as a result of these poor statistics. And our guest has been working on this for quite some time, and no doubt will have a lot to say that can be helpful to all of us. And I'm going to turn it over right now to Steve Montoya, who is one of our interns at the center. And he has made this possible, and he will introduce the other interns on the team, as well as our guest. Thank
Yes.
you, Steve.
Yeah, thank you, Dennis. Good evening, and thank you all for making the time. I'm Steve Montoya. I'm a public health student at the University of South Florida, getting my master's degree. And naturally, with public health, we do care a lot about health inequities. So I'm looking forward to this discussion with Ms. Jones, as she does have a lot of insight. Crystal and Laura, y'all can go ahead.
Like your heel. My name is Crystal Sampson. I am in my second year at George Washington University as a grad student studying public health with a concentration in maternal and child health. I currently work for a nonprofit organization in Washington, D.C. called Community of Hope that actually has interventions that I'm a part of working towards reducing maternal mortality rates in Washington, D.C.
Hey, good evening. My name is Laura Schroer, and I am going to be graduating with a Master's of Public Health in a few weeks, and I am excited to discuss Black maternal health tonight.
Perfect. And our speaker tonight will be Ms. Mia Jones. She's the CEO of Agape Family Health. She is a decorated community leader in Jacksonville, tirelessly championing for increased healthcare access for the underserved and marginalized. Spearheading these efforts under Ms. Jones' direction is the Agape Family Health Center, whose aim is to provide high quality and affordable services for those in need, regardless of their ability to pay. That being said, we will move on and begin with the conversation. First topic being based around equity, access, and affordability. So Ms. Jones, again, thank you for making the time. My first question for you, Black mothers face significantly higher rates of maternal complications and mortality. What specific steps is Agape taking to reduce these disparities and ensure equitable maternal care in Jacksonville?
All right. I think you'll hear me better if I come off mute. Good evening. Thank you for asking that question. We have been working in this area for the past 3 years. We make sure that we have comprehensive women's health services at our Dunn Avenue location where women can come and receive care and know that we have their best interest at heart. We have a multicultural telehealth program that speaks specifically to maternal health of our mothers and identifying disparities that they may be experiencing. We work with them by using telehealth, using scales, blood pressure cuffs, glucometers, and they use those, they are connected by Bluetooth. If they have been identified to already have those diseases or disease states, and if they don't, then we just have them to monitor by recording their information. And if they get to the point where they are experiencing those disease states, then we will move them to the Bluetooth devices where we can access and monitor them on a more regular basis. We work with our community partners, the Department of Health in Duval County, Northeast Florida Healthy Start Coalition, and others in order to make sure that we can meet the mothers where they are and address the needs and concerns that they may be experiencing.
Okay, very well, thank you. So my next question, with Agape's focus on affordable healthcare, what efforts are underway in making maternal healthcare more accessible and affordable, specifically for Black families in Jacksonville who may face economic or systemic barriers?
So at Agape, with us being a federally qualified health center, we have a sliding fee scale that we use to determine how much a patient would have to pay if they're uninsured. We have the ability to identify those who just don't have it. But based on their family size and the income of the household, we are able to work with them on a sliding fee scale. And then we work with our patients, whether they're moms or pregnant moms or just women. We will assist them in getting pregnancy Medicaid. We will work with them on getting the kids covered under CHIP. And if they qualify for any other healthcare, public healthcare programs, then we will work to get them connected to those programs by integrating affordability, recognizing that we have to find ways to ensure that we are keeping that door open for them to be able to have a healthy and successful pregnancy, because we know on the other side that will impact that next generation long term.
Yeah, definitely takes a village. All right, and then my final question for you, Ms. Jones. Black maternal mortality and morbidity rates have been shown to far exceed rates of other races. How is Agape tracking these maternal outcomes, and what strategies are in place to lower these rates among Black women in our communities?
For us tracking our outcomes, we use our electronic medical record system to monitor and to keep up with the data on the patients. It allows us to track when they first come in, being able to identify where they are in their pregnancy. We will work with them to make sure that we know what social determinants of health they may be dealing with. And then we look to find ways to connect them to resources that can assist them in having a healthy pregnancy and delivery.
All right, cool. I appreciate the insight. So I'll go ahead and pass the buck on to Crystal. She'll be going over the culturally sensitive and patient-centered care portion of the discussion.
Good evening, Ms. Jones.
Good evening.
My first question for you is, Agape's mission emphasizes compassion and inclusivity. How do you ensure that Black mothers receive culturally sensitive, patient-centered care from all providers in your organization?
It's something that we pay attention to. We get surveys from our patients. We ask them what their experience was, or if there's things that they could recommend that would have made their experience better. We recognize that it's important to hear from the patient and not just assume that we know because we're the healthcare provider. Our board is even made up 51% patients. And so we recognize it's very important to listen to the patient, not assume that we know, but to listen to them, because every situation is different. And you hear people say they practice medicine. That's exactly what they do. They practice medicine. And so if we don't listen, if we don't pay attention to each individual patient and what they're saying, what they're feeling, listening to them and understanding, then we have poorer outcomes. We work with our staff to make sure that they understand that. We talk about it. And oftentimes it's really more about keeping the lines of communication open so that the patient is comfortable, the provider is comfortable, and if one or the other isn't, then we need to take steps to address those situations.
Absolutely. My second question is, implicit biases have been shown to significantly impact maternal health outcomes. How does Agape train healthcare providers to recognize and counteract bias in order to provide equitable, respectful care to Black mothers?
We do that by making available to our providers training opportunities, whether that be training through other organizations within the city or outside of the city that specialize in that. That gives us the opportunity to make sure that they understand that they're not just hearing it from those that they work with, but they're hearing it from experts within the field. And we found that our providers have been receptive to going to those trainings and identifying ways that they can make improvements if necessary.
Absolutely. And my final question for you, Ms. Jones, is, considering mental health is crucial to maternal well-being, what mental health resources or support networks do you provide specifically for Black mothers who may experience additional stressors during and after pregnancy?
We have individual counseling available at Agape. If we are not able to provide that counseling, we have behavioral health nurse practitioners on board. We also have the ability to use telehealth and to access other organizations and to get additional support for our mothers. We also have the ability to, and we host group sessions. And that gives the mothers an opportunity to see that it's not just them going through whatever they may be going through, that there are others who may have similar situations and be dealing with similar concerns.
Thank you so much, Ms. Jones. I definitely appreciate your time and the work that Agape is doing to help Black and Brown women.
Thank you.
Okay. And then,
Okay.
yeah, go
Yes.
ahead, Lauren.
My first question for you, Ms. Jones, is how does your organization partner with local community leaders, advocates, or other health organizations to develop solutions tailored to the unique challenges faced by Black mothers in Jacksonville?
So we have made it a priority to partner with other organizations within our community that can be of benefit to our patients, whether it be the Healthy Start Coalition or the Department of Health, the Black psychologists and psychiatrists organizations, Black doctors. We find that we don't have to reinvent the wheel, and we don't have to be the captain of the ship for every single thing. So by reaching out to and partnering with these other organizations, we put in place memorandums of understanding or memorandums of agreement and identify their strengths, identify our strengths, and then we work together to get to the end result that we're looking for.
Great. That all sounds like excellent solutions to the challenges. My second question is preventative care and education are essential in reducing maternal health risks. What educational programs does your organization offer that are designed to reach and support Black families in Jacksonville?
And so that goes back to those partnerships. It goes back to making sure that we are able to determine when that patient comes to us what social determinants they're dealing with, and us being able to say, okay, Family Support Services has this program, and there's an opportunity for you to participate with this program. We do a warm handoff, get them connected, and hope that things go well. If they don't, then they come back and tell us that, and then we try to find other resources for them. We have found that the moms that have been participating in our program, they come in, whether they meet in domestic violence relationships, they could have financial situations going on where they need food. They may have housing issues and be unhoused. It varies. We do not have the answers for everything, but we try to work with our partners across the city to get them as close to what they need as possible. And that might be reaching out to the Salzbacher Center and finding if they have emergency housing available for a mom and a newborn. It could be making sure that we are able to get them connected to a city program that might be able to help them to get housing if that's the situation. We partner with Feeding Northeast Florida to provide nutritious food that would allow them to have a healthier pregnancy and sometimes just to simply have a meal. Our families are dealing with all sorts of things, and we try to meet them where they are.
Great. And my last question is, looking ahead, What emerging trends or innovations in maternal health care are you most excited about? And how is Agape positioning itself to adopt these advancements to best serve mothers and families in Jacksonville?
I would say the being able to expand telehealth services is one area that we are working in with our safety net partners, and being able to provide access no matter where the mom is, recognizing that transportation is often an issue for them. And we want to remove as many barriers as we possibly can. Using digital health tools, as I indicated earlier, whether it be a Bluetooth scale or a Bluetooth blood pressure cuff or a glucometer, being able to have them access these tools and someone qualified being able to monitor the results that are coming through on those devices is critical. We have found that, of course, it's very expensive. So we are partnering, if they are insured, then we are looking to the insurance companies to work with us and to provide the services that we may not be able to provide. So they may pay for the devices for their patients, which allows us to stretch the limited dollars that we have for those who don't have insurance. AI is going to become another tool in the toolbox that will be able to help to predict risk in the various patients based on what their experiences are and the information that's being provided to it. Collaborative care models, I think, are really, really important when we start to talk about that patient that might be in front of us, the obstetrician that they may see, the pediatrician that their child may see, the mental health provider that mom or baby or child may need. And then our social workers within our community being able to work together to get around the table and to talk and to come up with what may be the best solution for that particular patient. We're looking forward to those innovations. We have conversations and look to partner with as many within our community as we can. And those conversations go on all the time.
Oh, that all sounds great. I believe that's all the questions we have. Steve, do you want to open the floor for questions?
Yes, of course. Thank you, Laura. So if anyone has any questions, we'll be happy to share them. Feel free to add them in the chat or unmute yourself if you have any. Okay.
I was wondering, Ms. Jones, if you could share with us a couple of the things that you've discovered as you've been dealing with the studies on this and the attempts, what was local and now statewide, to provide more focus on this issue. What are some of the things that you've noticed and have been discovered that are the most serious needs and areas that, by making us all aware, we can be helpful in helping alleviate those?
Most often we have found that are more than we expected. The issues that our moms are dealing with are financial in nature, and as a result, it limits them in what they think they can access. So it may be a mom who's just found out she's pregnant, but instead of going ahead and starting to seek care as soon as she finds out, she waits. She waits because she might have heard a friend or someone say, well, Medicaid pregnancy Medicaid only goes for 45 days. And so if you go too soon, then you won't have enough on the back end to be able to deliver and to make sure you get the care you need. Bad information.
Mhm.
Being able to help them to understand what benefits they have within the community that are available to them. Our program has been funded by the state. They started off with $2.4 million for the first year, and we had to ramp up really quickly. And the second year, they went down to just over 600,000. So whereas the first year we were able to provide Bluetooth devices to every patient that came in, all of a sudden we had to come up with how do we determine who we're going to give these Bluetooth devices to versus regular devices that are, more reasonable in cost. We found that they have also had challenges as it relates to knowing where they can go. When I talk to other healthcare professionals within the community, maternal care is a challenge for many to get to. And so we try to remove the barriers that we find that they have. So it may be us creating transportation opportunities, whether it be having an Uber to pick them up and bring them to the appointment and take them back home. It could be us connecting them with someone else. But the past 2 years have been enlightening in that I believe the state is listening to the numbers, and they recognize that African American women are having a lot of challenges, but at the same time, I think they underestimate being able to fully fund what would be necessary to bring additional providers in. That's one of our issues. We need additional providers. And so there are a number of things. We learn something new every step we take in this process. And I think the more we study, the more we engage, the more we learn.
There must be a campaign, advertising campaign, social media campaign that I can see the sign of, if you're pregnant, don't wait, go get help. Is there a campaign like that?
Yes, the Healthy Start Coalition has a number of campaigns that speak to that. And we partner with them, and we are always encouraging our moms and actually just the community at large. If you have a medical issue, don't wait. Oftentimes, the disparities that we find in the African American community are because the patient waited so long to seek help that you start to limit the number of solutions that may be available to you when you take that extra time.
Right.
And so we want people to listen to their bodies, seek out that help, come to Agape, call us, let us get you an appointment and identify what your eligibility is, and then get you the care that you need.
So I hope our interns, I'm assuming they're listening, because I think we could probably help a little bit with that through our social media. We have a regular feed that we do, and we could certainly inject that kind of information and maybe even add it to our signature pages on our emails, just reminder. And then, of course, there is the telehealth that the city has made available now, encouraging people to use that.
Yes. I think you got to hang in.
Yes, Dr. Gracie Bell. Mhm.
Good evening, Mia.
Good evening.
Hi. My question is, since you've worked very closely with the topic, have you seen a decrease or increase in maternal death, whether it's mother or child?
I can't say that we've really moved the needle either way yet. I think as we find better ways to document that we will be able to dig down deeper and to get firmer answers. I think we have the opportunity with we're making some changes in data collection, the various partners that we work with are helping in terms of being able to identify those who have a true interest in the area and us trying to connect with them, to get them engaged and to help us to address the issue on a broader sense. When you have the one instance that will probably haunt me for a very long time. We had a patient who had been coming to us probably about 2 months, went into labor, and she called and okay, you need to go to the hospital. She said, okay, I'll go tomorrow because I don't have anybody here to watch my other 2 kids.
Oh, gee.
And she literally stayed home and went to the hospital the next day. And unfortunately, the baby died.
Hmm.
We offered to, let us call 911, get the rescue there to you. They'll take you and the babies, you and your kids to the hospital. So at least the kids would be, she could get the care she needed, but someone would be there with the kids. But she was afraid. She was afraid that not having somebody else there, who were they gonna put her kids with? Were they gonna, say, okay, these kids are need care. We're gonna put them in foster care for a day, or whatever. She didn't know. She didn't have any idea. But all of the worst things that she could think of were going through her head, and she felt the best solution for her and her kids was to wait for someone that she trusted to be there and to be able to stay with her kids while she went to the hospital. And unfortunately, that did not end up being the best thing for that unborn baby. So it's things like that, situations like that many would not even think about. In my mind, okay, if I'm in labor, I'm going straight to a hospital. I've never had kids, so I don't really know what I would do. But we try to be that listening ear, to be a place of information and to be a place of support for the patients that are coming through. And so we had a mom week before last that had given birth the week before. She was coming in to bring the baby in for their first visit, and the staff realized she just didn't look good. Something was wrong. We ended up having to call rescue for her, and thank goodness somebody came with her to the doctor. But they found that she had an infection. And, if she hadn't been at the office, she said, yeah, she had been feeling bad, but, she just was concentrating on the baby. What might have happened if she had not been there. And so we just try to find as many ways as we can to be of assistance. And we don't assume that we already have the best answers. So what we do is we continue to tweak our programs. And if we find a better way to do it, then we implement that and then we go from there.
Right. And my final question is, do you find that since the maternal health among African American women is higher than any other race, are you getting more people to come into your program, or is it that it's not publicized enough? What do you see that may be the issue?
What I'm finding is that we are not getting as many African Americans as we expected to participate in the program. We are getting a lot of Hispanics participating, and we continue to go out into the community, share the information, talk with various organizations, letting them know we're here, what we do, what services we're providing. We use social media as well. And word of mouth really has probably been the number one way that most of our moms say that they heard about us. And so we want to keep the word out there. We want to encourage people to talk about it. I go into a restaurant, I see a pregnant mom, I ask her, hey, are you participating in this program? She may or may not be. If she's not, then I'll give her the information and share it with her and encourage her to come by one of our offices so that we can get her enrolled. I asked the question, are you in care? And sometimes they say yes, sometimes they say no. But you don't ever know what that person is experiencing. That determines how they are going to respond. So I do what I can.
Right. Now that I know you've got a very comprehensive program, I will definitely spread the word. I wrote to the White House, that was last year, for funding. As I speak, I don't know how that turned out because I turned it over to the City Hall. Had I known about your program, I could have directly asked for funding for your program, but I did not know. Now that I know, I'll spread the word.
Thank you. And we're constantly looking for funding opportunities. Today, my team was on with HRSA, and they have a maternal health grant that's going to be open. And we were sitting through the presentation, a technical assistance presentation, trying to find ways for us to seek additional funding through them. We will reach out to and work with whoever we can. So my team they have a list of folks they're going to be reaching out to see if they would be interested in partnering with us, because there are portions of the grant that we can't provide, and we'll need support from other organizations to do those pieces.
Thank you so very much.
You're welcome.
And I see a Crystal have your hand raised. You can go ahead.
Yes, I actually thought about another question while you were speaking. So we know Black women encounter many obstacles when it comes to receiving equitable care, and research has shown that doula services can help improve birth outcomes for Black women. So does your organization utilize doula services to help your patients?
We do. We actually pay for it. Yeah. The moms have been very receptive to it. And so we do whatever we can to get them those services. Yes.
Thank you so much.
You're welcome.
Yeah, great question. And I believe we also have Aisha for the question, or Aisha.
Hi, yes. I just had a quick question. I missed the first little half. I joined on a little late. But for any women that you seek, do you see an increase or do you guys help those that have substance use issues?
We work with Gateway
Mm-hmm.
for any patients that come through that have substance abuse issues. And because they specialize in that,
Okay,
and we partner with them.
awesome. Thank you.
You're welcome.
Okay. Any more questions for Ms. Jones while we have her here?
Hi, Ms. Jones. I have a question. So I was just wanting to jump back to your patients and the intake that you have. You're saying that you had much more Hispanic people coming in versus Black women coming in. And just thinking about the social support that Hispanic women have, I'm not sure if you heard about it, but this Hispanic paradox where they're saying that Hispanic people, they usually have more social support and have healthier outcomes, despite being in similar situations as Black women, and then taking into account how Black women are usually isolated or experience significant social issues, so far as having support or having even say for instance the child father there. um how do you foresee your company overcoming those type of barriers in order to reach those Black women that you want to your program to attract?
You may or may not have heard me say earlier that the majority of the patients say that they heard about us via word of mouth. Someone told them because they learned about the program. And so it becomes important for us as an African American or as the African American community in Jacksonville to be that voice to help to carry the message, because we tend to move and act on things that have been validated by others. And so if someone that I trust says, hey, I heard about this program that Agape has, and I think you could benefit from it, the patient is more likely to take advantage of coming and seeing what services we have and if they can address the needs that they have. We look for, like I said, different groups to partner with, whether it be churches, whether it be schools, community groups. We've been some of everywhere, to just tell the story and to let people know that we're here, that we have the services available. We've got, actually, I got 2 marketing teams starting on 2 different projects to see if there are ways for us to increase the visibility and increase the information in the community about the services that we provide.
Awesome. Thank you so much for answering that question.
Absolutely.
This is Dr. McCassler again. May I ask, do you have printed materials to hand out?
We do.
Oh, perfect. All right, thanks. We will get some.
All right.
Okay. Any other questions for Ms. Jones?
I have a question. Do you guys provide at Agape, do you guys provide postpartum depression services for that?
We do. Our program will provide those services up to 3 months after the birth of the baby. And if we need to refer them for further services after that, we will do that.
I think, and I believe Aisha, you have a question?
Never mind. Sorry. Nothing.
All good. Anybody else?
I did have I guess it'd be a question. I was wondering, having spoken with, and looked at a number of policy papers on this that our public health students have drafted. The notion of poor nutrition, that in actual fact, the preparation to have a child starts 2 years before the child is born. And of course, if the pregnancy is not planned for, one doesn't focus on that. And even if it is planned for, I'm not sure all of us know. I certainly didn't realize that when I was um, along with my wife, going through having children. Have you been able to provide feedback to those that might be able to impact the health of the mother or potential mothers through what you've learned?
So we have provided, and we'll look for ways for us to continue to provide educational resources. All of us, when we go to the doctor, you have a good 15, 20 minutes with that doctor. So we can't rely on the provider to provide all of the information that may be necessary. So we try to have the resources, whether it be printed material or being able to have them to use a QR code to get to information that might assist in preparing for pregnancy if they are within childbearing age. We were awarded a grant probably about 4 or 5 years ago that we completed. But as a result of the work that we did with that, we found a way to implement long-acting birth control information education into the information that we share with our patients so that they would have time to prepare to have that 2 years. We talk about spacing of babies, not having one right behind the other, and it's 9 months between them. Why that's important, why your body needs to heal and prepare so that you can have a healthy pregnancy. So it all boils down to, I think the last question about how, what I saw what trends were out there, being able to increase the number of social workers and caseworkers that we have so that we can help to make sure that we're hearing from the patient to know where that patient is and what they're dealing with and what they need. So if they are of childbearing age, then it may simply be, we've got a class that we're going to be offering on such and such a day or in the evening. We think this will be a good class for you to go to. So making sure that we keep that information out there. And again, not that we have to be the facilitator of the program. We will partner with those who are doing that so that we can focus on providing the care. But we know that we have to be a conduit for our patients oftentimes.
Yeah. And this is just a comment. I attended a webinar recently on the effect of pregnancy on the immune system. And this is the kind of information that needs to be taught in high schools. So, because I had never heard this before, and the fact that your body as a pregnant mother takes over for the child, and if you don't get enough nutrition, you'll end up losing a lot if you don't take care of both of yourself and the child. But it's just really it's amazing what the body does and how it affects the immune system. So again, getting that information out to people seems to be so important.
Absolutely. It's like they tell you on the airplane, put your oxygen mask on and then put the mask on the person who may be beside you that may need help. For that mom, that baby isn't gonna wait to get what they need. They're gonna get what they need. The body is gonna give them what they need, but at the expense of mom not being able to maintain what she may need.
I guess one last question for me. You mentioned we were talking before the town hall started about the program that you were involved in and how it spread throughout the state. Do you think we have? You mentioned a drop in funding. Do you think we have the political wherewithal and focus that's needed to ensure success in dealing with the statistics on Black maternal health going forward?
Mhm. I don't know. It is a wait and see. We don't know how the election will impact the services that are available, the funding that's available. Maternal mortality was a priority area for the current administration. And so we've seen a lot of funding come down from the federal level to be made available for this, specifically recognizing the disparities that have been found. On the state level, last year, the expansion of services or access to programming came at the hand of a female Senate president.
That's right. Yeah.
And so
She's gone.
She's gone. She's
Yeah.
gone. And so we have to monitor what's happening. And when we see shifts taking place, we have to find ways to, okay, well, I've started looking for other funding sources. I don't know for a fact that that state money that we've gotten, although it was cut significantly, is going to be there. So I've got to find other ways to at least be prepared to do as much as I possibly can to provide the services that we know are needed.
Thank you. That was very helpful.
Absolutely.
Okay, so we're coming up on an hour. We don't want to hold Ms. Jones from dinner, but do we have any other questions or parting words before I let you all go?
I just want to say thank you for your time. Your organization is doing amazing work. I understand how difficult it can be to kind of get people engaged in what you're trying to do. And so, continue to push forward.
Absolutely. I want to thank you all for inviting me, for you all taking the time to do the research, to help to tell the story, and to learn even more than we already know. You all are the next generation. You'll be the ones who will be making these decisions in the long run. And so I encourage you to continue the work, keep the passion, and I look forward to hearing from you all again.
And on behalf of the Jacksonville Urban League, I did want to thank you, Ms. Jones, and our interns for making this happen. And we're very appreciative of your work. And this has been recorded and will be available on YouTube for others to view. And generally, this topic is always of interest in our community.
And
Thank you.
I want to say thank you. This was Awesome. Very informative. I was one of the persons that worked with the Biden-Harris administration as a certified representative for Duval County. And I wish I had known I could have made some moves on your behalf, but now that I know, I don't know how this new administration is going to operate, but you're very right. The Biden-Harris administration had certified workers all over the states that were going to weekly meetings, getting information and coming back to different counties and making requests for funding and whatever the need may be. But anyway, this was awesome. Awesome. Thank you so very much.
You are welcome.
And yes, Ms. Jones, very nice of you to make time. I appreciate your wisdom. And yeah, it takes a village. So, getting this information out, it's all we can ask for as things transition. But again, thank you for taking the time.
Absolutely. It has been my pleasure.
You have a
You
good
all
evening.
have a great night.
Have a great